Hey, it's Alvin from Priceline Pharmacy West Brunswick, and we're doing the Ask Alvin Q&A show live on Facebook, episode number 9, I think. Thank you all for your support. So for those of you who are just new, this is a weekly Q&A show that I run where you can jump on live and ask me any wellness related question, and I'll do my best at answering them. And if you have any questions, you can also leave them in the comments below if you're watching this again on the replay. It's just my aim to give you as much value as I can and help you to manage your medical conditions and help you achieve optimal wellness, which I'm a big advocate for. Just want to put all the disclaimer and all the legal stuff out of the way. So this is general advice. Please contact your healthcare professional or come in and see us for advice pertaining to your particular condition. If I do mention any doses, any medication as well, please make sure you always read the directions and use always as directed. And if you're not sure of the directions, please call us or your other healthcare professional and we can help you. So we've got all that legal stuff out of the way. Let's get down to it. So the first question we have is from Dylan. So Dylan's asking about how he can treat his back acne. So yeah, really annoying, Dylan, but also super common. So the first thing that I'd be recommending is to ensure that you're wearing the right kind of fabrics on your back, so your t-shirts and your shirts, to avoid synthetic products, because synthetic based materials, because they can trap in the heat. Some of them don't breathe as well, and by trapping in the heat you risk the chance of getting more pimples. So I'd be using stuff like merino wool or linen if you can, to clothe your back just to wear anyway. So that should hopefully minimize any chance of it coming back again. You can get some acne cream, very similar to the ones that we would use on our face. So generally the ones that we use for the back, a little bit stronger. They include ingredients like benzoyl peroxide and triclosan, however you say it. And you just apply that on the same way as you would onto your face or wherever your acne would be, but onto the back as well. Sometimes for a large area of the back, we also tend to use like an antibacterial wash, which contains the same ingredients, and then using the wash to cleanse the skin and then applying these on top over the acne area. It also does take a little bit of time to clear up there, Dylan, so to help the cause we also recommend that you would be taking some fish oil supplementation and also zinc. So fish oil is really good at controlling the what we call sebaceous glands, or the glands in your skin that overproduce, and that's what may cause the pimples. And zinc is also really good at skin repair, so that's going to help you help your skin heal up really quickly. So we're taking things on the inside and we're also using the medication on the outside. I'd also be looking at your diet, definitely staying away from refined carbohydrates like breads and pastas, all the same old naughty stuff that we know. Definitely stay away from the sugars, Dylan, as well, because that can just start to mess up your gut, and your gut is involved in a whole heap of processes around the body. It'll cause inflammation, which will just slow down the healing time of the acne on your back. Hope that answers your question, Dylan. If there's something in particular, please make sure you come back and see us, see one of our wellness consultants, see one of our pharmacists, and go through it a little bit more in depth for you. Thanks, Dylan. Next question we got here is from Alex, and Alex is asking, do pharmacists still make medicines or what? So Alex, it's a really good question. So now pharmacy these days, we don't actually make up what we call extemporaneous medication. All the medication comes to us from our suppliers. Most of the medication comes to us from our suppliers, already bottled and packaged up. We do, however, make some creams, and we make up some creams in our pharmacy because they have a really short shelf life, or there are particular formulas that some doctors and especially dermatologists like to use, which aren't available in a commercially available preparation. So we make those up. So we still got old school and mix up the creams using a mortar and pestle sometimes, I think that's a really good idea, Alex. I'll do a movie, or I'll do a quick video next time we do make up one of these creams, so you can see the process on how we go about doing it. Having said that, there are an emerging range, emerging pharmacies that do what we call compounding. So a compounding pharmacy is one where they make up the medication specifically for you, and it's typically because it's a formula that your doctor wants to use, or it's a medication that's not really that stable to live in the shelf life. But there are compounding pharmacies that make up a whole wonderful range of lotions and potions and medication suitable for you. So that's the older art of pharmacy that's still being practiced, but it's coming back in a new way. So yes, that's the main thing there, Alex. So we still do make medicines. Your general everyday community pharmacy does a little bit, mainly in creams. Your specialist compounding pharmacy does the whole gamut, from pills to tablets to creams, nasal sprays, lotions, and all that kind of thing. Alex, hopefully that answers your question. The next question we have is from Penny. She's asking how we treat her back pain. So Penny, broad question, I suppose. There's so many different types of back pain. I'll just give you our general approach to treating back pain. Typically with back pain, there's a component of inflammation there, so we generally use an anti-inflammatory if you can take an anti-inflammatory. Anti-inflammatories include the medications diclofenac or ibuprofen, or versions of each, and and a few other ones as well. So we would, depending on how acute it is, your back pain, so whether it's happened recently or whether it's been hanging around for a while, we would take a couple of different treatment approaches. So let's go if it's just happened. So if you're acute, what we call acute, if you've just done your back at the gym and whatnot, you can take some anti-inflammatories, which will work really well in reducing the swelling and inflammation. If your back pain is constant, ongoing, we would generally use a long-acting paracetamol and also some anti-inflammatories as well. Yes, you can use the two of them together. They work differently, but they work really well at maintaining, at relieving the back pain symptoms that you're having. So just remember, this is just purely symptomatic treatment, right, Penny? We need to then refer you on to Pilates, go see the chiropractor, go see the physio, try and get to the underlying cause of what your back pain is where the back pain is coming from, and we definitely encourage you to go see these practitioners as well. If it's something that you've organized, if you've flared up at the gym, please work with a personal trainer to look at your technique as well. In terms of managing with food, turmeric, coumarin, you've probably seen them in curries. That's what I'd be recommending. It's a really good anti-inflammatory. Please make sure you take your turmeric with some pepper, because pepper increases the absorption of the turmeric. So that's that yellow stuff you see in the spice shop, and you see in the cafes in West Brunswick, because everyone's munching and drinking turmeric lattes. So you can use the turmeric. That works really, really well. I'd also be recommending your green leafy vegetables. They have really high antioxidant value as well. So get onto those, Penny, and you'll find that your inflammation will be settled down a lot better, and obviously a lot of control. Obviously, it's still persisting there, Penny. Please make sure you go see your doctor, get some photos taken, make sure that it's there's nothing untoward going on. Cool, but quite specific back pain, Penny. So please make sure you come and seek some professional advice, and we can talk about your particular condition directly. Awesome. Next question today is from Maria. Maria is asking how I prevent chafing while I'm running. Hey, I know exactly what you're talking about. Maria, I'm a runner too. And chafing, especially in the heat that we're experiencing in Melbourne right now, super common. So you can get some particular creams which create a barrier, quite thick creams. There's a few different types of chafing creams. One of them is called Zora, but come in and speak to us. There's a few other brands that we can recommend to you as well. And basically, by applying the cream directly to the areas where you're experiencing chafing, it'll create a barrier, keep it nice and hydrated, prevent excess sweat. Ooh, the camera's doing funny things. Let's just see. Yeah, prevent excess sweat from coming on to that area. And it just allows the skin, when it comes into contact with each other, especially when you're running or riding, to glide really smoothly. So that's prevention of the chafing. But when you do get the chafing, your skin's all flared up, obviously. And in that case, we would generally use a cortisone-based cream if your skin is not broken. If the skin is broken, that means it's bleeding, in which case we'd go for another treatment option. But let's go step one. Your skin is red and inflamed, itchy, a little bit hot, the skin is not broken. We're going to use some cortisone-based cream because that works really well at reducing all the redness and inflammation. We would then use the cortisone-based cream. We can only use it 2 or 3 times a day. In between of doing that, we will use a very simple moisturizer. There are plenty of moisturizers in the pharmacy that we can choose that are hypoallergenic, so there's really hydrating, moisturizing. We're going to use that. And then we're going to avoid soap on the area because soap slows down the healing process, so we're going to be using a soap-free wash as well. So that's to treat your chafing. And if your skin is broken, Maria, then in that case we'll just use a very simple moisturizer. Sometimes you can get into a wound type of situation where it's constantly weeping. We may need to use a wound dressing there as well, hopefully not. And we can use some wound gel, which is just like a clear gel which keeps the area nice and hydrated as well. So pretty annoying, pretty complicated there, Maria, that we can, but we can definitely get the chafing under control. Cool, 4 questions. If anyone's got any questions, I'm going to do the wrap up now, so you can throw your questions down in the comment below, and if it comes up, I will answer it for you. But I'm going to reiterate all the legal stuff again. This is all general advice. I did talk about a few medications in there. Please make sure you use only as directed, and see your healthcare professional if your symptoms persist. Please make sure that you comment and like, so we can spread the word about what we're doing here. And even if you're watching the replay, please make sure you leave your comments, like and share it as well. We really appreciate that. And I will get to your questions next week. If you need any immediate questions answered, please call us 9380-9535. Our wellness consultants, myself, our pharmacists, all here to help you get better sooner. Cool. No questions. I will get onto it. I will get back to doing what I do, which is helping out patients and clients. And I will speak to you all next week. Thank you.